Hello, Holistretch fam. My name is Frances Eve. In this video, you will get to watch a short back massage. If you are in the holistic health and wellness field, then most likely you will have the opportunity to gently massage your client. If the fascia is very dense and tight, or they're extra stressed and anxious, then this type of bodywork is perfect for them. Please subscribe to the channel if you haven't yet done so, and enjoy. We'll go ahead and begin by gentle palpation, always starting with your knees bent, hips over knees, shoulders square right over your client's shoulders. This allows for optimal body weight compression. And we move from left to right. This gives you the utmost body weight as you're moving and rocking into the fascia. Working with the olecranon, or the forearm, we gently press down the body weight into the trap, being very mindful of how the hand is lifted up, keeping it relaxed, keeping your whole body relaxed, and your weight evenly distributed. We can press down on the hip to allow more space in the sacrum, low back. Really good for clients with low back issues. And it's also great to stretch out the spine this way. So one push downward and the elbows stretching it upwards. Always we begin with palpation, so feeling around which muscles are tight, tense, what areas we can get into, which ones are stuck. And for much denser areas, we use the olecranon as we can allow more body weight to compress. Coming to the skin-to-skin contact, I like to keep a little massage cream on my forearm so I don't have to always reach for it. And we begin by sliding down the sides of the spine, covering up the full space of the spine, the back. And we end right where the thumb presses into the SI joint. This is a great place to gently massage with the thumbs. Just be mindful of your alignment. I like to use the knuckles of the hand as I like to avoid the nails. So I always tend to use the olecranon, the knuckles, and the forearms. Using your fingers as tools can often have you become weary as a massage therapist. It can cause joint issues and misalignment issues, so it's always best to see what other tools you have in your arsenal, like the palms of your hands. We'll go ahead and start to work from one side and then into the other by gently scooping up along the ribs. This is a great place to release stagnation, sadness, And then we can work our way with the olecranon once again, gently using the body weight, being mindful of your shoulder right over your elbow, always maintaining your body posture and alignment. When we get to a tight spot, I like to ask my client to inhale deeply, and then as they exhale, I exhale with them and gently drop the body weight down to compress and stretch, releasing knots along the way. Always following that line of tissue all the way down the body, never stopping short. The lymph is only moved by the lightest of touch. Breathing while you practice is imperative for staying present and feeling into your channel for guidance. Remember that your body carries the knowledge that it needs to practice with the other beautiful human in front of you. Using the knuckles to pull the tissue up and over the shoulders. Being mindful of the joints whenever you get to the joints, being sure to soften up. Sometimes a very dense tissue, instead of going straight, it might be helpful to rock your body just a little or make little circles, helping the fascia to relax, to trust, and to soften. Slow is key. If the muscles don't trust, if the muscles are holding on, they're super tight and tense, they probably won't release with fast and hard movements. In fact, it could cause more trauma to your client, and they may close up even more, even if they say they like it. Listen to the tissue. The tissue will tell you how to release the issue. Breathing into your body allows your whole body to relax, takes you out of your mind, takes you out of your judgment, takes you out of your thoughts. When we do go deeper the client's tissue and relax our full body weight, always be mindful to relax all the other parts of your body, like your hands, your shoulders, even your belly can support in adding more weight and tenderness to your client. If one angle isn't necessarily working, you can try another angle with your elbow just by bending the forearm, and a duller angle by opening up the arm. Sometimes with very dense tissue, I like to use a gua sha just to gently scrape or scraping the ATP away from the muscle, allowing it to soften and relax. And as we come to a close, we do nice gentle broad strokes once again. Cover them with a sheet. Breathe and pray for their healing, their fast recovery, and their peace. Thank you so much. Feel free.